to see that the teenagers are taking a initiative to do this study, and Sri Yoga platform, they can use it, and so hopefully they will get some useful information from all of us. And even though some people are not attending right now, we can share the recording, and then go from there. So with that, again, Diana, I would suggest that you start by introducing your team, and then go over the rest of it. Okay, thank you.
Sure. So, thank you, Shriji, and hi, everyone. My name is Diana. We'll go into a little more team details in our presentation as well, but we are part of a nonprofit organization called Project Unity, which helps a lot of high schoolers and the future generation of healthcare workers and people in public health learn more about the healthcare system and healthcare both in America and around the world, and working on combining public health as well as digital health in order to create better solutions for the future. So I'm Diana, and we can go through our routines.
Yeah, Diana. I'll get more into my introduction later in the presentation, but just for now, my name is Smriti. And actually I'm proud to say I'm a member of Sri Yoga. I recently joined his classes, and I really think yoga is something that's a huge part of my lifestyle now. And aside from yoga, being a Project Unity intern and working with Diana and Abhay has actually really allowed me to get more into research and understand more about public health. And I'm happy to be a part of this project in trying to learn more about sleep medicine and the correlation of sleep quality and physical activity, and trying to help improve the lives of teenagers, but also just everyone who is affected and influenced by this problem.
Thank you.
My name is Abhay, and as Diana and Smriti said, you'll get to learn more about me in the slideshow.
Okay.
Great. I'm going to share my screen so we can start our presentations. And if anyone has any questions, feel free to put it in the chat. Otherwise, we'll have time towards the end of our presentation to discuss as well. So as I said, our group here today, our research group, is participating in this as part of Project Unity, which is a nonprofit, and I'll go into more details as well. But our presentation is mainly going to focus on the relationship between physical activity and sleep medicine. And we will go into introducing our team. Abhay, if you want to start.
Hi, my name is Abhay Singh, and I'm a rising junior at the Center for Medical Sciences at Mills E. Godwin High School near Richmond, Virginia. I I really gained an interest in mental health after I saw many of my peers go through struggles with it, and it really is an epidemic right now in our country. And seeing others go through it, and even going through some challenges myself, I really gained an interest in, hey, how can I help them? How can I understand them? And how can I help them get better? So I joined an Active Minds group at my school, which is it's a subgroup of clubs that are really dedicated to helping people improve their mental health through certain events and certain practices. Through there, I also got certified in teenage mental health first aid, which only served to boost my interest in teenage mental health. So after that, I did research last year on how teenage lifestyles affect their mental health. I looked into factors such as physical activity, sleep quality, sleep amount, diet, workload, screen time. And then I mapped it to how that affected their cognition, life satisfaction, their depression chances, their anxiety chances. And because of that research, I really did gain a respect for how your lifestyle and factors that you may not even assume can actually affect your mental health on a really deep level. So because of that newly gained interest, I ended up joining Catalyst Academy this summer, and I'm really, really happy that I did because I've gotten the opportunity to do public health research, but also learn from so many amazing mentors and attend speaker meetings from so many renowned speakers that know so much about public health and the future of it. And now I'm here with you all with the support of Project Unity and my wonderful research group to present our research, which is how does physical activity affect your sleep quality, and how has the COVID-19 pandemic played a hand in that? Thank you.
Thank you, Abhay.
Hello everyone. Hello again. Yeah, so my name is Smriti and I'm a rising junior in the Global Ecology Magnet program at Poolsville High School. And I'm very passionate about exploring and learning about the intersection of AI and healthcare. And kind of growing and stemming off of this passion, last summer, I actually, with a group of goal-oriented students, I worked on creating an AI-driven automated pill dispensing machine through UMG's Cyber Physical Systems Engineering program to help with the problem of medication non-adherence. And aside from my STEM-related activities and extracurricular activities, I'm also a yoga enthusiast and a very passionate Carnatic music singer. And I'm also an avid, like, I love playing tennis. And because of this, I am a tennis teacher for kids with autism to help them improve their motor skills. And finally, as a proud Catalyst Academy intern this summer, I'm working on a research project with Diana and Abhay regarding sleep medicine. And I'm so excited to be exploring innovative solutions in public and digital health with them.
Excellent, Smriti.
Right. And hi, everyone. My name is Diana Jacob. I am a Master of Public Health student at George Washington University. And I also got my bachelor's in biology from the College of New Jersey, where I'm originally from, with a minor in public health. And I also graduated high school not too long ago, but I graduated during the 2020 COVID-19 pandemic. So our topic is something that is very important to me. And I'm really interested in learning about how this can affect our high schoolers today as well. Mental health is something that I have learned a lot about, and I've experienced with a lot of my friends and other individuals I've interacted with throughout my life. I've always been very interested in healthcare. And so during undergrad, I was able to be a part of various mental health organizations, both for the college student population, also South Asian mental health organizations, and various opportunities I had to meet various people who really benefit from public health at the mental health level. I've also been a camp counselor in various capacities, and so that kind of led me to join Catalyst Academy this year. I am a peer mentor for our research group here, and so I'm helping our high school students combine their passion for learning about public health and especially combining that with digital health. And for me personally, I'm really passionate about educating the next generation and then also working to improve health equity outcomes, especially within the future of healthcare.
Thank you, Diana.
So I'm just going to go a little bit more into what exactly Project Unity is. So Project Unity is a 501c3 nonprofit organization dedicated to cultivating essentially the next generation of healthcare leaders. And so we're really looking to educate students and professionals on the essential principles of public health and digital health, and really equipping them to understand what kind of knowledge and tools is needed to address the broader determinants of health and overall improve healthcare delivery. So we're mainly targeting high school students, but we're really looking to create a combination of how we're able to look at various age groups and combine all of our areas of expertise and be able to learn from each other at that level.
Can you explain what is digital health education?
Yeah, definitely. Digital health education is mainly the aspect of we right now live in the 21st century, and even any sort of aspect of our life that includes any sort of electronics. So whether it's our computer, our phone, looking at our electronics, it's very much at the tips of our fingers, and everyone is always able to access some sort of electricity at where we are, especially in like the DMV area and especially in the United States. So digital health education is mainly looking at how we can use our personal digital devices and how we can use that in order to learn more about our healthcare. So whether that could be in a way of like using an Apple Watch or a Fitbit, something in order to learn more about our healthcare, whether it's monitoring how many steps you take in a day, your different workouts, um, even for cardiac patients, things like using EKGs and things like that are all ways you can use digital health to learn more about personal healthcare.
Thank you.
So the program that our students are doing this year is Catalyst Academy, which Abhay and Smriti talked a little bit about, and it's our Project Unity's flagship public health program. So it's a 8-week summer program for high school students, mainly immersing students in public health, medicine, and as I spoke about, digital health, and equipping them with a lot of professional, leadership, and research skills. And so the program ends with a Unity in Public Health Research Conference, and students will be presenting their research findings using scientific posters. So at the end of our program, all students walk away with a research paper where they are an author, and they also walk away with a poster presentation that they're able to say that they worked with a research group in order to create this paper and presentation and eventually come out with a publication that they can further use for college admissions or even further than that and talk about in interviews and such. So all the research papers are eventually published in our annual public health journal for Project Unity. And for this year specifically, our program is all across America. We have students from right here in Maryland to California to New York, Ohio, Florida, various states around the country. And it consists of over 50 high school students. They have to go through an application process and things like that. And then we also have over 20 graduate student mentors that are either doing their master's or studying in medical school. And we also have various advisors that are either doctors or any other healthcare workers that are interested in working with Project Unity as well. So now we're going to talk a little bit about our research.
So like Diana previously mentioned, we are just one research group within this year's cohort of Catalyst Academy. And the summer program this year has about 60 students from across the country, and we are actively expanding every year. So our group is specifically looking to do research about the relationship between physical activity and sleep. And our population of focus that we are looking at are students aged between 13 to 17 in Baltimore County, Maryland. And we also want to see how the trend between physical activity and sleep has changed over the pandemic. So before, during, and after COVID. The reason why we chose this topic is because we were all affected by the sleep and physical activity issue, and we didn't just continue forward with this topic for research purposes, but also because this is something that continues to affect our lifestyles till this day. Our goal in this program is to understand what the current state of physical activity and sleep is for high schoolers to help address any issues that are not allowing high schoolers to get proper physical activity or sleep.
So before we really started talking to stakeholders, talking to people, we did some research on the literature about these topics already. And here are some key findings. Poor sleep and low activity are really rising in the US. 82% of United States teenagers have poor sleep, and only 20% meet the physical activity guidelines. So the issue is there and it is very real. And both of these, they directly impact their mental and physical health, linking to anxiety, depression, and stress-related disorders. And these disorders down the line end up shortening lifespan and causing a variety of other issues because stress is one of the number one killers. And additionally, disparities really exist. Low income, urban, and racially marginalized teenagers, especially in Baltimore County, are the most affected because they have the least space and the least priority for this, but they also have one of the highest needs for this.
Yeah, and COVID-19 also worsened a lot of trends, leading to less access to school gyms and facilities to work out, more screen time usage among adolescents due to things like virtual schooling, and also consequently worsening sleep quality. And also additional things like poverty, unsafe neighborhoods, poor health education, and media all played a role in the overall downfall of teenagers' sleep quality and mental health.
Sorry to interrupt, but why did you select Baltimore County only?
Yeah, so Catalyst Academy wanted us to focus on a certain area to conduct our study to get good enough data to possibly help that area that we're looking at. And we chose to look at Baltimore County because most of our members were actually from the Maryland area. So unfortunately, we only have us three here today, but we actually have two more members, one of them being from Maryland as well. So since both me and that member were from Maryland, we decided to focus our research in the specific area to also apply possible interventions.
So, are you getting enough inputs from kids in Baltimore County?
Yeah, so because for that reason, we're actually in the process of trying to survey kids in this area so we can get direct input from them, which we will further discuss later in our slideshow. Yeah.
Okay.
So, throughout our research, we found a lot of statistics which really helped us understand why this issue was really important to focus on, especially a main one being sleep. So, teenagers need between 8 and 10 hours of sleep a night, but polls show that most teens get much less, as you can see in this photo, with 60% of middle schoolers only achieving this goal and 70% of high schoolers not achieving this goal.
Oh, and the other infographic shows that the sedentary lifestyle in kids is really increasing. Children who watch TV for over 3 hours a day have a 65% higher chance of being obese than those children that only watch TV for less than an hour a day. Kids who have a TV in their bedroom watch 56% more TV daily than those who don't. Screen time is increasing and it's linked with higher risk of adult obesity. In 2009, kids spent an average of 89 minutes per day using a computer for fun, as opposed to 5 years earlier from that, it was 62 minutes, meaning it was about a 50% increase. Teenage boys who spend less than 7 hours per week watching a screen are 40% likely to become 40% less likely to become obese adults than teens who spend 25 hours or more on screen activities. Our goal. The goal of us being here, the goal of us doing this research is we want to understand what are these trends? How are they really related? Can one lead to the other? And how has the COVID-19 pandemic affected it? What can we do to help the kids of Baltimore County with these issues? We want to identify barriers, like what's stopping it? If we know what to do, if we know get better sleep, get more exercise, why can't we? What's stopping us? And we want to design an intervention or a public health program to address these issues. We want to work with the schools, the policy professionals, nonprofits, anyone in the area that really cares about these issues. And then we're going to work with them to establish a solution that is based off of evidence and research. But we need your help. So we wanted to introduce a 5 minute anonymous survey. No names, no addresses, no emails will be collected. And on the next slide, there's a QR code that you can scan. This survey will really help us gauge how really is this problem in Maryland as a whole. Not even specifically Maryland, but anywhere. We just want to get your input on how big is this issue in your life.
So before we ask you all to fill out our survey, we wanted to show you what exactly was in our survey so you know what you would be filling out. So the reason that we have this survey, Abhay did explain, but in terms of what exactly we're doing with our information, as Abhay said, we're trying to create a public health program that's trying to improve the physical activity and sleep quality rates in Maryland. And as we said, specifically Baltimore County and within teenagers as well. So we want this data to understand what the current landscape is in terms of how much physical activity high schoolers are getting, as well as their relative sleep amount during their school nights or otherwise. And so during our survey, we don't just want high schoolers to answer our survey questions. We also want a lot of the Maryland population and outside Maryland to also fill out our survey, because if we only had the information for our high schoolers, that would only tell us what exactly they're doing. But we also want to know if they're doing better than adults in sleep or if they're doing worse than adults in physical activity and things like that. So that's the reason we are asking you all to fill out our survey as well. So as you can see on the screen, this is the first portion of our survey. At the beginning, you will be asked to read our consent statement, and you just have to check if you consent to participate in our survey. And then for the first portion, we just ask for your general age range. So we have various age ranges within our survey, and we ask that you put in your age. There's also an option to not share your age with the researchers if you don't feel comfortable. We also ask where you're located. So since our research is focused in Baltimore County, we are asking to separate that from the rest of our research. And then also let us know whether you're in Maryland or in the United States that is not Maryland. Otherwise, you can specify what exact location you are answering our survey from. And then we're also asking you all to let us know when you attended high school. Of course, not the specific year or any details like that, but simply whether it was before the COVID-19 pandemic, during the pandemic, or after the pandemic. So, like I said earlier, I went to high school during the pandemic. I graduated as class of 2020. So my senior year was overtaken by the pandemic. So I would answer this as I attended high school during the COVID-19 pandemic. And so it would vary between all of your answers as well.
The next section, it asks about your physical activity. So the first question in this section is asking, how many days of the week do you engage in physical activity like sports, yoga, walking, gym? And we give you a couple of ranges. And if you don't engage in any physical activity, you have an option for that. The next question asks, on average, how long do you get physical activity? Less than 30 minutes, 30 to 60 minutes, over 60 minutes, or if you don't engage in physical activity. Next question, what types of physical activity do you do? And if you want to add any others, you're welcome to, because any type of physical activity counts. And the next question, on a scale of 1 to 5, how physically tired you are after being active, and if you engage in yoga, how relaxed do you feel after a yoga session? These answers will help us establish how does physical activity help you, how tired does it make you, and how relaxed does yoga especially make you.
Part of our research, our survey also focuses on the sleep habits of our respondents. So by looking at patterns across different age groups, we hope to get a better understanding of how widespread sleep-related issues are and how they might be affecting people's overall health and daily lives. We're interested in learning how many hours of sleep our respondents typically get, and for those who are still in school, whether school-related responsibilities are affecting their sleep. We're also looking into how physical activity, whether it's yoga, running, or just playing a sport, impacts their sleep patterns. And in addition, we want to understand whether they personally feel that being physically active helps improve the quality of sleep overall.
Yeah.
So one question, you didn't have any gender specific question, whether it's male, female?
Yeah,
Um,
for our research, we're only necessarily focusing on the differences in age and location as well. So you don't need to specify your gender for the survey.
Okay.
Abhay, you can go.
And as I think Abhay answered the question, I am assuming the survey is for everyone, not just for the teenagers.
yes, meant for everyone. And I think on the survey we have like an option about like what age group you fit in. So it's really just for anyone who would be willing to help us in our research.
Now, we are also asking if you all would be able to give us your thoughts on what you think is missing from your communities that could potentially help high school students, especially in the areas of getting more physical activity or sleep. We also know that since many of you are yoga students, we want to ask you, how has your life changed or been impacted by yoga? Has it affected your sleep, your mental health, or maybe your physical activity habits? We are open to any and all thoughts you all may have. And please feel free to scan the QR code, fill out the survey, or if you would like to offer your insights into any of these questions, we would really appreciate your inputs.
So that is the end of our presentation. So as we showed before, all the survey questions we mentioned during our presentation. So please fill out our survey here if you're able to. You can just scan with your phone or any other device. Otherwise, we can also send Shriji the link to our survey, and we can also put it in the chat as well if you guys would like to fill it out on your computer.
I will provide that survey to everyone along with the recording of this session, and also mention specifically that this is not just for teenagers, it's for everyone. So, okay. And then wish you all the best. And I would like to open it, whatever comments, there are people that are not necessarily teenagers, but anything that they may have some ideas or some inputs to you for your survey, let's just open it and get some inputs from other people. Thank you. You can stop the screen share.
If anyone has any questions, anything that they would like to ask us about sleep, physical activity, we would love to answer your questions.
Yeah, this is Priya Mahata. Can you hear me?
Yes.
Great. I think first thing I couldn't open the because I'm using my phone. So if you could share the link, that will be great. And another question, I think I saw in Smriti's presentation initially, she said there is some AI assisted pill dispenser or something like that. Can you tell us something more about it?
Yeah, of course. First of all, thank you so much for asking your question. So the pill dispensing, AI-driven pill dispensing machine that I actually built with a few other students is not directly related with Catalyst Academy, but it was a project that I worked on through UMD's Cyber Physical Systems Engineering Summer Program.
Mm-hmm.
And we all just we were brainstorming issues that we were seeing in today's like realm of public health, and a huge one that we saw and noted was medicine non-adherence. So like especially like my grandparents, for example, like they have several different pills that they have to take, prescribed medication.
Right. Mm-hmm.
And a lot of them like are different dosages, different times, different like days they have to take them. And it's
Mm-hmm.
it's hard to keep track of them, especially as you're aging. So we
Right.
wanted to create a device that kind of did it for them. So it's connected with an iOS app that
Okay. Mm-hmm.
so the users are able to input all of their prescriptions and all the information regarding it. So when they have to take it, how many, like the dosage regarding it. And once they have done that, the iOS app will sync all of that. And then the actual device, we 3D printed all of that. So the hardware, and it has 4 different sections. So you can fit up to 4 different prescribed medications within that device, whether they're tablets or pills. And according to your set time that you need to take them, the iOS app will send a signal to the machine. And at that time, the machine will send an alert through like a beeping sound and also like a flashing light that will alert the users that, okay, this is your time to take your medication, and it'll come out of the machine. And we actually created that mechanism using a motor. But so it'll come out at that specific time, and it'll send an alert through the app as well. So it's not really affiliated with Catalyst Academy and Project Unity, but it was just a small project I worked on last summer.
No, it's a great initiative. I mean, this will help lots of people, lots of elderly people, they don't remember the dosage and things like that. So it will be, so where is it available in the market or what?
Yeah, so since this was actually under like Cyber Physical Systems Engineering, the program sponsored by UMD, they actually paid for all of the costs. So we actually had to order a lot of different parts and download a lot of different like softwares and stuff to actually code the iOS app and things like that. So due to all of those financial constraints, they actually have kept for displays. And since this is a recurring internship that happens every summer, it's kind of used as a display. But so it's not really out for like
Right.
yeah, sky, but
Yes,
we're actually trying to work on
mhm.
that. But yeah,
You may have to get some approvals from FDA or something like that, right?
that's a huge process.
Yeah, yeah. But this is overall great program. We are really impressed, great initiative. Thank you very much for sharing with us.
Thank you so much for attending. Yeah.
Hi, this is Malala. I'm a pediatrician. It's really great research project you've chosen because it's very prevalent right now. I was just wondering, did you ever add or think of adding social media as a reason of not getting enough sleep? Since all teenagers are on phone or any device.
Yeah, that's definitely a major portion of part of the research we found why students aren't getting sleep and also lack of physical activity. It's very much students or kids just sit on their phones or iPads and they might just be in bed on their sofa so they won't sleep or do physical activity. But we're actually looking, so kind of what we want to ask you all as well is we want to create a program that addresses these problems. So we're curious, like what you guys have seen, if you guys know any kids or high schoolers, any solutions to addressing things like social media and other reasons that they might not be getting good sleep or good physical activity. So we are looking into potentially addressing social media as part of our public health program as well.
Oh, good, because I think that's the major issue right now.
Yes, definitely. Thank
And
you.
Smriti and Diana, if you want, I can share the contact of Padma. Since she is a pediatrician, maybe she has a better insight into the problems of kids, and you can directly get some inputs from her in addition to the survey and all the things.
Yeah, I think we would actually love that, Juji, because Dr. Padma, Auntie, like, yeah, you probably saw, but we're specifically focusing on teens aged 13 to 17. So anything you'd have to share about this issue and things you've observed in sleep and all of that would really help us.
Did you talk with your parents to add any more concerns like when you are working on this project? The reason I was asking because sometimes in school or something there is lot of peer pressure and harassment and everything and how that thing is affecting their sleep and all kind of stuff. And usually like if you, I don't know if you did it or not, but couple of you teenagers or like Diane or you in college, whoever finished their high schools, because I just, my granddaughter was visiting last week and she's going to college, and my nephew's kids, they are graduating from college now, so they were giving that my granddaughter lot of tips what goes in college, just prepare her mentally. So since you are talking about sleep and all others. So maybe something, if you haven't done, you can think about adding that in your survey or in your discussion
Yeah.
to affect the sleep.
Yes, definitely. Like we all spoke about, like mental health has really been an impact of in all of our lives, like whether
Yeah.
it was during high school or after, and definitely bullying harassment comes a lot
Mhm.
from like high school, especially in that age group, and that definitely also
Exactly. And
adjustment.
it's not only just girls, but I heard like boys also. They also are always under peer pressure.
Yeah.
And that one of the boy who used to come to our house, he's the one mentioned that he was telling me, Auntie, it's not girls, but we boys are also always under that pressure, kind of peer pressures. So I just wanted to add that you are doing really great job. Yep.
Yeah, thank you. We'll definitely make sure to include that in our discussions as well.
Yeah.
Good luck, and you can always approach our Mr. Subnis, and you can get reach to many more people too, if you need anything. So
Yes.
For your kind.
we wish you
Yes,
wish
thank
you
you.
really good,
Yeah.
So yeah, best wishes.
Thank you. Congratulations.
Yeah.
Thank you.
Thank you, Swati Subhash. Anybody else? Otherwise, now we'll end the meeting, and again, we'll make the recording available to you. And again, along with your survey, I'll put a note that it's for everyone, and just encouraging everyone to fill out the survey. And again, you can send it to other groups also.
Yeah.
So this is like a common problem. It's not specific to anyone, and people sometimes are reluctant to fill out a survey, considering that their information may be used. But you are already have said that this is you're not getting any personal information from the people, and it's more just something that will help you with your survey. So that's excellent, very good. So I'm glad to see the entire survey that you have. Thank you.
Can we get your contact information also? Because if my granddaughter, who is going to, because they're very active, and if they would like to participate in some of your activities, they can contact you directly. Miss, I'm going to forward this recording to them. They are in Atlanta.
Yeah. Yes,
So-
definitely.
So I will share the contacts of
Okay.
Padma, Lala, then Swati, and whoever else is interested in share the contacts with you, and then and again maybe I will ask that question if they would like to be share their contact when I send out the email.
Yeah.
Yes. Also, Shriji sent out a flyer before this presentation that has my email as well. If
Okay.
you guys, want to reach out, especially about Catalyst Academy or anything. If you guys know any high schoolers that might be interested, the
Sure.
program growing every year, so we'd love more input from high school.
Okay. Thank you. It's a really good program.
Yeah.
Thank you.
I sent the survey already. So.
Okay.
Me too. I also completed this survey.
Oh, great,
But
great,
this is
Priya, great, Padma.
but a great
Too
initiative.
fast.
Yeah,
We cannot
very good.
keep up with.
I don't like to postpone things.
But
Yeah,
it's really good. Thank you.
Yes,
Thank you
even if
very
you
much.
guys could even put the survey link in like family WhatsApp groups or anything, just share it with as many people. Doesn't have to be
Sure.
limited to
Yeah.
Sri Yoga. We would really appreciate.
Yeah. We can do that.
Yes.
And that would help.
Excellent. Very good, kids. We are doing great job,
Yeah.
and so wish you all the best. Okay.
Yeah.